Hello there, sports fans. We've got Dr. Gina Pritchard, whom I consider one of the top experts in the world on heart attacks and stroke prevention. She's on the cutting and bleeding edge of things. And today we're going to talk about a test that blew me away. It's called the spit test or the saliva test. And with it, with you just basically hold up a tube and you spit in it, and then you send it off. You can do this in the comfort of your own home, and it can tell you what your chances of you having or getting, and correct me if I'm right on this, Doc. We're just going to dive right into this. Heart attacks, strokes, cancers, um, problem pregnancies, Alzheimer's, dementia, brain abscesses, tooth implant rejections, bone loss and arthritis, diabetes, kidney disease, and am I leaving anything off here?
Fatty liver disease. Did we say
Fatty
that?
liver disease. No,
That's
I
about
did
the only one
not.
I can think of. Then we might
Fatty liver
have
disease,
kidney
which
disease. I
means,
think you said that, but
yes, fatty liver disease is associated basically with a type of diabetes, or you can get it when you have
it can be
insulin.
because,
Yeah,
yeah, we're talking about the non-alcoholic fatty liver disease type. Certainly, you can
right.
get liver disease or dysfunction from too much alcohol for sure. But the other type is a similar problem with the liver,
Hmm.
but it's from too many carbohydrates.
Right.
However, this type of, when we find the evidence in the saliva,
Okay.
the person may be ingesting too many carbohydrates, or it may be that they are knocking on the door of diabetes or have diabetes and don't know it.
Right.
But the pathogens play a role in that. The,
Okay.
the findings in the mouth play a role in
Okay.
all.
So there's five main ones as I understand it, plus a whole slew of other ones. There's a couple of other ones that played this role. So what if correct me if I understand this correctly. So I with the spit test that takes literally 30 seconds to do, well, whatever, how long ever it takes to get to your postman. When they do this, because of these pathogens in your mouth, um, it's linked to, if you have them, it's linked to like 50% of the cancer, some of the cancers. And I know it was over 90% of people with diabetes have this. And are they, um, do they cause it, or is it an indication that you have it, or both?
Well, let me just speak. Each one of them is a little bit different, each one of the disease conditions that you just listed. But I'll just say with cardiovascular disease or heart attack or
Right. Part of
stroke, for
right.
example,
Okay.
these bacteria are directly implicated. So they are causal of cardiovascular disease. We still need much more research to understand how do they get out of control in the mouth? How do they
Hmm.
thrive in the mouth? So actually, which came first, the chicken or the egg? That's really impossible to say right now, but we
Hmm.
know they are. Numerous studies have demonstrated that they're implicated, directly contribute to, and are found at the site of heart attack and stroke. And that's
Right.
on the American Heart Association website. This isn't new information. It's just we haven't known what to do with it or how to get
Right.
it there because we haven't known how to even begin treating it until more recent years.
Okay. And if I remember reading in the research, and maybe I heard it from you or some, I'm sure I read the research on this too, that, and I know you did a long explanation with it. I was on one of your Zoom calls, that it said that basically, if you can get rid of some of these bacteria and balance them out with the good bacteria, because there's good bacteria too, that you
Mhm.
can greatly reduce your chances of these diseases as well.
Yes, I would say number one and number two, you can greatly reduce your risk of getting those diseases,
Mhm.
of having a heart attack, of having a stroke,
Right.
diabetes, all
Hmm.
of these things that none of us want in our future. You
Yeah.
can definitely reduce that risk, number one. Number two, you will not, if you've had a heart attack or if you've had a stroke, you are likely headed for another one. The recurrence of that is high. Or even if you've had a stent and known cardiovascular disease, you will not reverse the disease process. You're still at greater risk if you don't get rid of these. So you have to get rid of them to have to protect yourself from having these diseases in the first place. And then
Yeah.
once you have these diseases, we will not effectively treat them unless now at that point we
Right.
test saliva and we treat these pathogens, get rid of the pathogens.
Okay, so this makes sense. I mean, I just recently heard about this maybe 4 or 5 months ago, what boggles my mind is, and you can correct me on this, and I want to take a humorous tone here, but this is pretty serious. It seems to me like, and I had one of these done, that why aren't every dentist and every doctor making this the first thing that they test if this can indicate what's going on with all of them? And if I had a heart attack or a stroke, that if I don't get rid of this, I'm going to be far, far higher of getting another one.
Mm.
And the same thing with diabetes. And the thing that I've had friends do this, that they had implants and they got rejected. And after I spoke with them, they never mentioned that they got tested for these bacteria that are the cause for the rejection. I mean,
Mhm.
it does do like 98% of all dentists and doctors check for this right now, or what's?
No, absolutely 98% of doctors and dentists do not check for this right now. And I would say that answer to that question has about 10 reasons, but I'm going to give the top ones. Okay.
Okay.
Number one, they're not aware. The doctor, dentist, dental hygienist just doesn't know about these bacteria being dangerous or
Right.
being that dangerous. The research, as I said, that first started to be talked about in some of the medical community and at some of our conferences was around 2013. Before that, all of us knew that it was a problem, but we were like, but how do we test for it? What do we do for it? How is this clinically applicable? So there's about three other reasons in the beginning of why we didn't embrace it right away and why doctors and dentists still don't, even if they know about it. So like,
Right.
what do we do with this information?
Right.
The next reason is because some have taken a stab at it and start testing for these bacteria. And there are a few different steps to take to eradicate them in the first place, to
Hmm.
reestablish the health of your mouth. Because if
Right.
these are found, then the mouth may look healthy, may smell healthy, may taste healthy, but it's not healthy
Hmm.
unless you reestablish the good bacteria, so to speak. Create an environment where your mouth can be healthy again because the good bacteria have overcome the bad bacteria and we've gotten rid of the bad guys, so to
Right.
speak.
Yeah.
So, in order to do that, number one, a medical team or a doctor, a nurse practitioner, whomever you're seeing for anything other than dental care, has to work together with a dental team, a dentist and a dental hygienist. Either side of the aisle, so to speak, can only go so far. And so, what I found, even when I first started testing individuals and doing my part, so to speak,
Hmm.
I would send them to their dentist with a note. They would come back and I would say, what'd they do? They said nothing, said I looked fine. So we had to start talking to each other, start
Hmm.
collaborating and merging our care plans for the patient. And some don't know how to do that. Some doctors and dentists and dental hygienists and nurses don't know how to have those conversations, don't have the time to have those conversations. We found it to be very easy. We, meaning myself and the dental teams that I do work with and the nurses and dental hygienists that are on my team as care coordinators. But in the beginning, it was cumbersome, as you can imagine.
Right.
It's a little bit to back and forth, and then keeping the patient educated in that whole process. But now we've got that refined. The other thing I would say about this is it's not covered by insurance. And so a
Okay.
lot of that's just like a hard no for a lot of doctors and some dentists, but
Hmm.
it will save your life. It's not that expensive. It may someday be covered by insurance. I say insurance is like the I word, a dirty word, because it
Yeah.
doesn't say for the test that doesn't pay for the test that will actually save your life
Hmm.
before a problem. And this is just one of those examples. So
Right. Well, I heard something the other day that makes so much sense, that I had a doctor tell me this about 7 or 8 years ago, and I'm not trying to put you on the spot here, but he told me that it takes basically 20 years for something to be found to really work, and all the data is there for it to be filtered out to the doctors that they are actually using it widespread. And
mhm.
I found that I was dumbfounded. And but he explained it to me, and I had someone else explain this to me the other day. Her name is Sydney. I'm not going to go to last name, but she said basically, if the insurance does not cover something, that it is not taught in the medical school, which leaves out like most of the things that are there. So is that semi accurate? Is that what's going on?
It's what's going on. That's problem number one. It is not taught in the medical schools and it's not taught in the dental schools. And so I talk to dentists all the time. Let's say, for example, I was seeing, the patient in front of me right now, called their dentist or called their dental hygienist and scheduled a call for us to talk about our mutual patient. They would say, I've never heard of that. I wasn't taught that in school. And
Right.
some of them even go as far to say, I didn't graduate that long. Like I have some dental colleagues that are in their 30s and 40s, and I've had a couple of them call me back and say, I called my professor of periodontal disease and in dental school, and he said that he doesn't know anything about it either. So just getting the word out there and getting the science out there, getting the research and the treatment protocols out there
Right.
is something we're trying to do every day. But if you weren't taught it in medical school, a lot of people are still hanging their hat on that, which we know data is changing every week, every
Rapidly,
every
yes.
yeah,
Yeah.
rapidly. So that just is a problem in and of itself.
Hmm.
If I practice the way I was taught when I went to school, certainly in the undergraduate, but even more recently, things have changed in the last year or two. I
Yeah.
mean, that's how rapidly it's changing. But you're right, it does take 20 plus years. And as I said, it was starting to be talked about in 2013 when the American Heart Association finally took a stand. But we knew about it 2005 to 2009, somewhere in there. We knew, wow, there is something to this. We've got to start figuring this out.
Right.
And you can see we're not 20 years from 2013. So
It, yeah. Okay. So my official scientific term for that is that's nuts. That is totally crazy. Um, so that being said, before, and this was, I think right now, the last time I looked, if you go to your site, thespittest.com, it's thespittest.com, it's only $249 for this test. Insurance is going to cover it, but that's like a month or two of Starbucks to reliably predict whether I'm
mhm.
going to have diabetes, if I'm going to have issues with my teeth, if I'm going to have a stroke, if I'm going to have cancer, if I'm at least leaning towards that, or a brain abscess. I know that's the other one, but
Mhm.
just the heart attacks alone. Um, they just had women's heart attack, something I heard a month ago. That's the leading killer of women right now, right? Heart attacks.
Yeah, February is Heart Month, but the focus on women and heart disease for sure, with
Right.
Women's Health Awareness Day in February. And more women die of heart attack, heart disease, cardiovascular disease than they die of all types of cancer. And
Wow.
it is a woman's disease as well as a man's disease. And that's
Right.
still a myth out there that most people think it's more likely to happen to men, and that's not true. There are
Right.
some stats around that, and that it sometimes, not all the time, but I would say the average is that women experience it or begin to know they have a problem a little
Mhm.
later in life than men know they have a problem, but it's still just as deadly. Women are more likely to die of their first heart attack. Men are more
Wow.
likely to survive the first one, go on to have another one. Women, that's not the case.
They
They are
just first one and they're done, huh?
more often
But
than
is
men.
uh why is that?
I think there's a lot of reasons. One,
Like,
and the research would suggest one of these things, and that is that women's anatomy is, in general, and we can't say in every case, but in general, our heart and the arteries, the blood vessels that supply the blood to the heart, are
yeah,
smaller than men's.
right.
And so if you think about a blockage or a blood clot that
Makes
can cause
sense.
a heart attack, it just
Yeah,
takes a smaller one to do it, because
right.
the vessel itself is not as big, the heart itself is not as.
Correct.
That's one reason that's indeed true. Another
Mm,
reason is that women's symptoms are not the same as men. You hear about, I feel like an elephant sitting on my chest,
right.
or yeah, crushing chest pain, or a
Mm-hmm.
wheezing chest pain. Those are
Mm-hmm.
typical, maybe jaw pain, shortness of breath, things like that. Women are more likely to feel indigestion. I have
Mm-hmm.
had this happen in my practice. A woman comes to see me more times than not and says, I've had the worst indigestion of my life and nothing will touch it. Like, I tried everything. She goes through the list. So it sometimes feels more like indigestion. A lot of times it's a finger or an elbow or an arm discomfort, jaw, back, shoulder, nothing in their chest. They're like, no, my
Mm,
chest feels fine. And again, it's probably something to do the difference in anatomy, just slight differences. So women,
right.
you've heard of typical left arm numbness or left
Mm-hmm.
arm if it
Right.
persists
Yeah.
heart, but
Hmm.
women it's likely to be in the right arm also, or in the
Hmm.
finger or the elbow, as I just said. And
Yeah.
so nagging, gnawing, that's not right kind of feeling from the waist up, women
Right.
should be checked out, as well as unexplained fatigue. And so
Yeah.
I think therein lies the third issue is women are always fatigued. They're taking care of
Right.
taking care of the grandkids, they're making sure everybody gets to the soccer practice, everybody's
Hmm.
fed. And not that men aren't busy too. I'm just saying we're so tuned in to being in the mother role or the grandmother role while maybe
Hmm.
also working that we just ignore
Right.
things. And there's a great video on the American Heart Association website that, as you said, they're trying to bring a very serious topic into somewhat of a humorous video so that we
Hmm.
will pay attention and go, oh, I see myself in that video and get checked
Right.
out.
Yeah, that's great. And according to the American Heart Association, uh, and I know you have your website, Skip Your Next Heart Attack, as well as the Prevent Clinic. In there, you talk about being able to reduce someone's risk of having a heart attack by over 80%.
Mhm.
And that's according to the ADA. How do you do that? I mean, I don't
Yeah.
think most people
So
realize that.
you are correct. The American Heart Association, the AHA, has driven a stake to the center of the earth and said 80% of heart attacks are preventable. And
Wow.
most strokes are preventable. That's not me saying that. That's a lot of data and a lot of genius minds that come together before they're going to make a statement like that from
Right. Yeah.
a global organization or certainly a national organization like the American Heart Association. So the American Heart Association, 80% should not be happening. And it's still the number one killer and has been so for many, many years. The recommendations that they bring to light that they say, if you will just incorporate these 8 things, then this is the way to prevent 80% of heart attacks. What I see in my practice, that number is well above 95%, the ability to prevent 95% of heart attacks. And it's because most of the evaluations done in the doctor office or even in the dental office, number one, they don't look for all of these things. We're
Right.
not in a traditional setting evaluating for all of these things. So the workup is incomplete.
Hmm.
And when we do look for these things, maybe the next steps are not as complete as they be. Like for one example, one of the items on the American Heart Association website is to get better sleep. But
Right.
I don't know anybody other than maybe a handful, maybe 10 practices where we say, no, we're not going to give up until you're breathing well all night long, you're
Mhm.
sleeping well all night long. There's several things you really need to monitor. We have great metrics these days, great
Right.
targets to measure, and oral saliva testing is one of the top ones that's always not on the
Right.
always missed, and it is a top contributor to heart attack and stroke risk. That's why I can in my practice take people from 80% protection to 95% or higher, because one of the things I'm testing for that most and treating are bacteria in the mouth or an altered unhealthy oral microbiome in the mouth.
Mhm. Wow. That's
Test we're
some
talking about.
crazy numbers. And I know you can never guarantee that, but it's based on data and things. Um, I know everybody always talks about they passed their stress test, but that may be okay. But if they aren't testing for the saliva, they've got a couple billion of these guys that are working against them that they
Yeah.
would never know about it. And if that could be rectified by I'm assuming, and correct me if I'm wrong, diet would have a big thing on it. If you're eating carbs, and I also heard if you gargle, that kills not only, there's they said kills 99% germs or whatever it is. It's killing off the good guys, which typically give the bad guys a chance to get in there. So it increases your risk of not having a decent biome. How do you treat it? Let's put it that way. How do you treat it?
Yeah. So one thing I just want to say about what you just said is that you mentioned gargling kills 95% of bad germs or whatever. So when we're
Right.
talking about gargling with some harsh product,
Right.
there are like you can gargle with water and it's actually good for you. You can gargle, that's a good thing.
Right.
But to use these products that most of us have in our homes and use every day alters the health of your mouth. And so it makes it difficult for, as you said, the good guys to out smart these bacteria and these dangerous pathogens, they overtake the mouth. And
Right.
they're sneaky because you can look great. Your gums can be pink. Your breath can be good. You can go to the dentist and they say, you look great. But if the dentist office is not testing for these pathogens, now the ones that are like me. Like, how did I try to treat patients with cardiovascular disease all these years without testing and eradicating the bad guys and then fostering in a healthy mouth? Because
Right.
then you can keep them at bay once you have them, eliminated or eradicated. Okay, so first and foremost, you take away anything that could be contributing to these bacteria thriving in the mouth. And we start with the mouth, but we know that your GI tract is affected by these bacteria because you're swallowing them. So that's a lot of the problems with GI. So we have to get to that second. First of all, we get rid of the products that are feeding them or making it an environment where they enjoy living there, and they just duplicate and they take over. Secondly, then we identify specifically which ones are there, and there are specific treatments for it. One of the treatments is to put in the probiotics. We've all heard of probiotics that we swallow because we've heard they're good for our GI tract. But these specific bacteria are not affected by certain probiotics. So you have to get essentially a prescription. Even though they're available over the counter, you have to know which probiotics to take to eradicate the pathogens. That's step number one. Number two, after you've gotten rid of the products in your home. And then after you get on the right probiotic, and it's usually a probiotic that you will melt in your mouth, let it sit there and marinate, if you will, or saturate the mouth, and some that you swallow, both. And then sometimes we give you gels and sprays in a variety of ways to improve the health of the mouth. And then once we do that, then we have to work with the dental team for them to do a treatment that may be necessary. This isn't true of every case and every time, but many times these bacteria live up under the gums. And again, you may look great when you go to the dental office, but if these bacteria are there and you have a dental hygienist and a dentist that is educated on these pathogens, they'll say, we're going to go take another look. Maybe we're going to take a different new kind of x-ray using a CAT scan to look deeper, because with the naked eye, maybe we're missing what's actually going on there. It's cellular level, right? Bacteria, a lot of times you can't see them. You can see the problem they're causing. Like if you have an infected wound on your hand, and you culture it, oh, there's bacteria there. Well, you didn't see the bacteria. It's the same in the mouth. You have to be a little bit of a detective to figure out where they are. And then when they're found, you might need a laser treatment in the mouth. You might need something called guided biofilm, which is just a comfortable procedure, but the dental hygienist has to perform it in a very meticulous way, not just clean your teeth and you look good and that you're good for another 3 months.
So they have to be trained in this, right?
That's right.
And from the information I had too, there's only two places in the world right now, maybe more. There's one place in St. Pete that you can get this, the IDM Scholar
Mhm.
Society, and
Mhm.
then the dental school in Knoxville, Lincoln Memorial. They
That's
also
right.
have an osteopath school. They're beginning to start training us too. So there's two places where you can
Yeah.
get trained for this stuff. Is that correct? Is that another reason why no one knows about this?
That's correct. And
Yeah,
there's a handful of dentists that are in our trainings, one that
right,
I'm associated with in well, both of those you just mentioned, actually, I'm
right.
associated with. And there are dentists and dental hygienists, nurses, and physicians that are in these
Hmm.
trainings and are in various stages of developing mastery at treating
Right.
these. And when you have those educational backup pieces in place, then we're always talking about what's the latest research show, how's it
Hmm.
looking in your cases, bring us your cases. So
Right.
you can see how it's a lot of people out there. I say a lot in
Yeah.
the grand scheme of things. As you just started us out, all of the doctors, all of the dentists are not testing for this. Very few are testing. And then
Right.
of those few that are testing, there are of those a few that are really trying to stick with it until they figure out how to eradicate them. And the reason I want to stop and make that a point is because a lot of times a dental team will test for them and they'll say, here, this product is good for that.
Right.
And
But it's not one single product, right?
it's not one single
Yeah.
product. and they
Right.
don't retest. So if your dentist tests and says, here you go, this will take care of that, and they don't retest, don't rely on that, because
Yeah.
maybe it will and maybe it won't. But you want a follow-up test to make sure they're gone. And if they're not, then there's some things that we're missing. And my experience has been, and the data shows, as you just said, Andrew, it's not just one thing. If it were, we would just sell that instead of the test
Yeah.
and have
Right.
everybody pray with or gargle with whatever worked. But it doesn't. In fact, a lot of the things that are being given to treat this are much like the mouthwashes over the
Mm,
counter. They have
mm,
harsh chemicals in them. And yeah, maybe it suppresses the bacterial load for a day or two or a week or whatever. And
right.
then they come back as a resistant strain with a vengeance. So everybody
Right.
heard about MRSA, right? Or this
Hmm. Yeah.
flesh-eating bacteria in the hospital. So
Hmm.
that's a resistant strain, meaning it started out as a staph infection we could
Hmm.
easily treat with antibiotics in the hospital.
Right.
These bacteria in the mouth started out as bacteria that could be easily treated with either some simple products, with
Hmm.
sometimes antibiotics, and still today we still need to use antibiotics as much as we hate them in some
Right.
cases, because if you keep using harsh chemicals and don't really eradicate the bacteria and improve the health of the microbiome, then you
Hmm.
get a resistant strain like flesh-eating staphylococcus, like
Mm.
MRSA, if you will, because they're going to win the war.
So if you don't kill them all, you get a couple that are resistant to it, and then they can overwhelm whatever you're doing. You know what? Kind of reminds me, like wherever they've done things where they go in and um, where they have a pest problem. They kill off the predators, and then when you do that, which are the good guys in this case, the rabbits will like explode and they take over everything, or lemmings or mice or anything. Kind of crazy stuff. Hopefully, people can relate to that. So,
Yeah.
wow. So on your protocols, what do you suggest? I mean, it seems to me that, and I'm not going to put words in your mouth here, but I would be getting tested like at least every year, if not every 6 months or every quarter, because depending on what's going on, that could change. And if it has that big of an impact of me getting cancer, stroke, dementia, Alzheimer, which is the big one,
Mhm.
um, which is an epidemic right now. Uh, I mean, is there any danger of like spitting in a tube too many times a year? Or
No, everyone needs
okay,
to be tested at baseline and at least once a year. If you look pristine, beautiful, no problems at baseline, then don't wait any longer than a year to be tested again,
right,
because you can pass these bacteria around. You do pass these bacteria around with the people you live with,
right,
certainly with your significant other that you're kissing, but you can share it with children, grandchildren. We've even tested it in some of the pets in the household. As crazy as that sounds, if we have
wow,
someone in my practice that's high risk, that's headed for a heart attack, and it's our job to turn that around, we're testing the spouse or the significant other, we're testing the children, and I have gone as far as testing the animals. Now that sounds crazy, but I just want you to know that it's communicable. It's a communicable, you can even drink after someone or share silverware or whatever.
okay. Stop, if you don't mind, I'm going to be rude here. Stop back up. But so like if like it sounds to me that it's closer to head lice. you know, if somebody no seriously, if you're sharing things, if you're drinking out of the same water bottle or doing something and you can share saliva with anybody.
Mhm.
I'm not trying to scare people, but
Right.
you could get it from your wife or your husband or
Mhm.
your kid, or
Mhm.
if grandma came over and drank off of it. And
Mhm.
so if you're high risk for this, then you could test out okay 3 months ago, but if you're around a bunch of people, you could pick
Mhm.
it up from them. Is that true?
That is true. That is
Wow.
absolutely true. And you've been on, several of our calls and courses, so there's a lot of precursors for that, a lot of reasons
Right.
why that happens, and we're looking
Right.
at all those also.
Right.
The place to start is to just see where do we stand with the
Right.
spit test, and treat everything that's contributing to it, get rid of the bacteria, then ensure it's gone for the rest of your life, and that the mouth becomes even healthier after
Right.
that. And that's a critically important point, because you need a certain saliva test. There is a new one on the
There's a
market
bunch of them.
every
Yeah.
month. You need to make sure that you're getting one where it's not just those 5 bacteria. That's okay. It's still important information, but then to know if you're actually So a follow-up test like that would help you know, are the numbers coming down? Are we starting to get rid of the bacteria? But then you need to know, is the rest of the mouth healthy? In other words, we want to check for yeast. We want to check for good strains of some of the strep strains. We want to test for other organisms that contribute to health so that those are allowed to thrive, and those are increasing while the bacteria are gone. So anyway, the correct test, which of course is the one we have, the spit test, and it's not been out that long. It's the latest, greatest. It's the one you want. Now, if someone improves and we have a better test, you're going to hear it here first.
Right. Well, it sounds to me like, I've got a marketing agency and we're technology agnostic. We don't get sucked in because we're getting paid from some affiliate fee for old junk software. If something new comes along, we tell our customers about it, even if we don't make any money on it, because we have their best interest at heart. So you don't get locked into any one test. If you see one that's bigger or better, you do it. Okay, that makes sense. Because I know, anyway, I don't want to even go there. But wow, that's really cool. And then so one of the big contributors that, because I've been doing, as you know, I've been doing keto and intermittent fasting for a while, that simple carbohydrates, can they contribute to this? And I'm not putting words in your mouth. If I'm wrong, just tell me. So is the diet, how important is your diet to this too?
Yeah, your diet is extremely important. And when we talked earlier about things that contribute to these bacteria being allowed to thrive and take over in the oral cavity in the mouth, uh, carbohydrates are one of those things. And we've seen an increase in this problem and no decrease in heart attacks since the beginning of the Industrial Revolution. And think about it, like during that time frame, and then also after the Depression, when food became more processed and started to be manufactured in a grand scale as opposed to have going out and using your own animals or less processed food. That's all I'm trying to say. So we're all eating way too many carbohydrates. We're taking in way too many toxins, and we're taking in way too much processed foods. And so you can imagine that, yeah, that changes the pH, it changes the environment of the mouth. And that alone is one of the reasons why these bacteria just take over. The other reason is because when you eat carbohydrates, you generally, even if you don't have diabetes, even if you're young, even if you're healthy, if you're wearing either like a continuous glucose monitor, maybe everyone on here has heard of those, used to just be for diabetics. Now we're using them in everyone to screen for glucose spikes. So if you're eating carbohydrates, your blood sugar is going to go higher, whether it's a processed carbohydrate or not. And I'm not eliminating a food group here. I'm not recommending that. I'm just trying to explain that will move you further along towards diabetes by eating carbohydrates. We know that to be true because your glucose will spike. That also makes the mouth more favorable for these bacteria because they thrive on sugar. They love carbohydrates to live. And then in there lies the difficulty explaining which came first, diabetes or the bacteria, because they just exist together, unfortunately. And we're all headed towards diabetes if we don't watch our carbs. I'm not saying eliminate it. I'm just saying it's a key point, our diet.
That makes sense. And I know you talked about Candida, which is basically a yeast. Is that correct? So if anybody's ever made bread, you want to see how fast it grows, put some sugar and some yeast in some water and watch it start bubbling. And that's because they're multiplying exponentially. So same thing happens in your mouth.
That's right. That's exactly right. Yes.
Yeah.
It's kind of like what's the opposite of an explosion? Instead of an explosion to get rid of the bacteria, it's like feeding them. It's giving them everything they want to just replicate themselves and become stronger and bigger and take over.
So there's one other thing I don't want this to run on too long. It's fascinating. I could talk to you for hours on this. So it seems to me that I mean my own mind, I'm not putting words in your mouth again, that since I got the one spit test, it didn't hurt. I did it in the comfort of my home. It took less than 30 seconds. I mean, once I figured out the things, you spit in the tube, put the cap on, turn blue, put it in the package, and send it off, or the postman will even pick it up from me. That seems to me like anybody that's concerned about their health would do that, and there's no danger in doing that. And like you said, at least once a year. And I'm looking to see what my results will be, even 90 days from now. One of the things that you talked about, you talked about your mouth health, and then you talked about your gut health. I don't think you use that term. We've all heard the term leaky gut syndrome. You came up, I don't know, I guess from what I recall back in in that's been known for a while, and it took forever to get out there. But you came up with another term called leaky syndrome, where it's just not about your gut, but your gums can leak, and with these other things, your veins can leak, your arteries can leak, your lymph glands, every cell can leak, and so it's more systemic than that. I guess, it's not just about leaky guts. Can you explain a little bit about that?
Yeah, so if this is the first time anybody's hearing about leaky gut, the more technical term is intestinal permeability. All that means is in the GI tract, we're talking tongue to tail, really. When we say intestinal, there's just a couple of spots in there that are actually small and large intestine. But from tongue to tail, that's really the GI tract, gastrointestinal system. You want that to keep that tract extremely healthy. Obviously, it's what's going to help you maintain your weight, or if you need to gain weight, lose weight, you need a healthy GI tract. If you want to be protected from all these diseases we just talked about, if you want to lead a high performance lifestyle, or just feel good with whatever it is you have to do for the day, you want your GI system intact. Leaky gut is referring to the fact that inside the lining of this GI tract, we have a membrane, and it's supposed to allow the toxins that are supposed to go through and be eliminated to go through, and the toxins that need to be taken to the bloodstream and taken to the liver to go a different route. It needs to take the nutrients, the things that are good for you, down a certain pathway. But what happens with these bacteria then enter in the mouth that we're swallowing with unhealthy food, and there again a whole list of contributing reasons why, then this membrane starts to allow particles through, and they go to the wrong places. So it's not like you look and you say, my belly's swelling, I must be leaking, I must have GI, leaky gut. You don't see it. It's taking it, it's still maintained obviously within the body, but it's going the wrong place. And
Right.
that's one of the reasons you get fatty liver disease. Your liver is just overrun with too much, because step one, the mouth, the nose, the mouth, and the GI tract are not able to do their job. And so the liver is leaky because it's overwhelmed. And
Right.
so we can talk about that with every organ in the body, is it becomes leaky
Yeah.
and everything becomes dysfunctional. It's no wonder that we live as long as we do when you start to see what's going on at the cellular level.
Yeah, that makes sense. So what you just said reminds me. So people I know, they have protocols to get your gut biome, which
Mm-hmm.
is great. But okay, so you get that done, but if your mouth isn't taken care of too, this is only going to last us for not very long, because it's going to leak down into your gut. It'll leak into your cardiovascular system.
Yes,
And so, wow. Okay,
that's
cool.
true. Yes, and in fact, we've had several studies that have explained to us exactly how does a bacteria that's living here
Hmm.
cause a heart attack. Like
Right,
even I, in the beginning, I'm like, how does that happen? I need to understand that.
right,
The short version of that is when you
hmm,
swallow them,
right,
they get your GI tract is leaky and they go the
hmm,
wrong place and they end up in the bloodstream. And there's
hmm,
actually more than just that one mechanism. There's about
right.
5 ways they get to the blood vessels, as you
Okay,
said.
right.
And when they get there, they are implicated. Like when you have a heart attack, these bacteria are there. They
Mm.
are absolutely causative. They're stirring up trouble, I like to say.
And they're always talking about cholesterol, but I don't hear anybody talking about the bacteria.
It's exactly what I was getting ready to say too.
Wow.
So it's while
That's
we
not,
swallow these
again, I'm using that
bacteria,
term. It's absolutely crazy.
yeah,
Crazy.
they're trying to drive cholesterol down or drive
Yeah.
LDL down in the
Yeah.
traditional healthcare system, when
Hmm.
it's a lot going on in there at the artery
Yeah.
level,
Right.
bacteria and something called cytokines, which is just kind of like these poisons, and
Hmm.
a lot of things, toxins. And so your cholesterol and your LDL, that's coined the bad cholesterol, is
Yeah.
actually at first trying to solve the problem, trying
Right.
to help you at the artery wall level. So to just eradicate it or drop it as low as you can, we now know that's not the best approach. Can't ignore
Right.
cholesterol, can't ignore
Right.
LDL,
Right.
HDL. That's not what I'm saying, but I'm saying you need to see somebody that knows how to treat it appropriately and look at all of the other problems that are actually uh,
Wow.
occurring in the blood vessels. and
Yeah,
in the brain.
that's okay. So it's just not about lowering your cholesterol at all. So hmm.
Yeah, no,
Anyway, a lot to think about.
yeah, a lot to think about. And it made me
Yeah,
think of hypertension or high blood pressure. We didn't even
right.
mention that one. But of course, when somebody goes to the doctor and they get put on a second med and a third
Hmm.
med, wow, I don't really think we want to add a fourth med, but whatever kind of recommendations they're given,
Hmm.
they are checking for these bacteria. And if they're there, you can see based on what we just described about how they
Hmm.
get into your bloodstream,
Right.
it's impossible for you to have your blood pressure
So
with
so the
medication.
medication just covers up the issue because they never take care of the bacteria in your mouth or whatever they are.
That's
So is
correct.
it, oh dear Lord.
Yeah.
So I'm going to ask you something. If you choose not to answer this question, because I don't want to get you in trouble, because I know that you've got all kinds of regulations and stuff. But is it possible for someone, once they take care of the bacteria in their mouth, once they eat the right diet, and they're reducing their, at least by the American Heart Attack, by 80%, can they ever get off all of those medications? Is it possible to reduce them or get off them by
Absolutely.
taking care of a systemic approach like this?
Absolutely, it's possible. When
Yeah,
someone and everybody that's practices a powerful prevention approach like I do, or a longevity approach,
right.
our goal, my goal, you see all
Mhm.
kinds of practice patterns, is
Right.
not to say the first time I see someone, I want to get you off all those medications. I
Yeah.
do, but I want to save the person's life. So at
Right.
first, I may not start taking medicines away,
Mhm.
but you can see there's so many things that need to be tested that aren't tested and
Right.
treated effectively. And once we start to do that, then the patient says, I'm dizzy. My blood pressure is too low. Okay, we got to get you off that blood pressure medicine. Or those are
Mhm.
things we're watching and tracking
Right.
for. We don't need a high dose Lipitor, Crestor,
Mhm.
Zocort, some kind of cholesterol medicine that
Right.
once we start to treat these things appropriately. So we have to
Yeah.
look one step sooner than just measuring the blood pressure. Okay, why is the blood pressure high? Can we get to
Mhm.
the root cause of that? And then
Right.
maybe medication. That's
Right.
the
Because it might be because you're eating like a pig and you're 50 pounds overweight and you aren't exercising and you're not breathing right or doing a whole slew of things right. And if you get healthier, you're going to, then decrease your blood pressure and your chance of dying of pretty much everything. It's
yeah,
connected
and
to that.
that's also why, unfortunately, incredibly fit people have heart attacks and strokes.
Yeah.
We saw the video earlier of the gentleman who had a heart attack at the end of his, it was either Ironman or marathon,
Mhm.
incredibly fit individual who
Right.
ate incredibly clean. And
Mhm.
that's a very
Supposedly incredibly clean. Yeah.
yeah, right. It's a very scary thing to think about. But the reason that I'm bringing it up is because if you take all of that advice about eating healthy and exercising, great. We all need to do that. I'm all for it. We're not going to get somebody as healthy as they want to be without making those changes. But it's another area of where the healthcare advice or the medical advice is incomplete. Because even if someone, like we were speaking earlier on this interview, if someone is eating too many carbs and eating an unhealthy diet, these bacteria can thrive. And just
Mhm.
because you fix your diet and your lifestyle doesn't mean they're gone.
Mhm.
Hopefully, they're less virulent, if you will, or less
Right.
dangerous than they were, but you still need to be tested.
Right.
Not just the bacteria, but these other things we test for to say, okay, has my healthy lifestyle
Mhm.
done what I hoped it would? I like the way I'm looking in the mirror, maybe,
Yep.
or I like that I can run a mile now where I couldn't, or whatever your goal is.
Mhm.
But what's going on the inside? That just needs to be tested. That's all.
One of the other things too is that what attracted me to you, and that, like I said, I want to help. I'm helping you get the word out as much as I possibly can. Once I figured out how much I didn't know, is that you use state of the art AI testing protocols that I have never heard of any other doctors doing.
Mhm.
And obviously, I'm sure those, based on what we said, they're not covered by insurance, but they're state of the art. Can you tell us about that?
Yes, absolutely. And it's an example of how rapidly our availability I mean, these things are available to us now. This AI that you're talking about, I haven't been using it in my practice longer than 2 years. It was, I believe, June 2 years ago when I did my first test using this particular technology you're talking about. And I've incorporated stuff since then that's AI component, has an AI component to it. So that's when I say our targets and our measurements and our metrics are getting better. They really are. So when someone says it's not possible to stabilize and reverse cardiovascular disease, it's not possible. Well, we used to know it was possible, but I say with a kind of a fuzzy idea that we were reversing it. But now with artificial intelligence, there is no doubt. And I'm not the only one saying that. That's
It's
well
measurable now.
documented. It's
It's measurable. Yeah,
measurable.
there was a oh, I forgot the name of the movie, but there was a whole documentary on the guy that had where he reversed his, cardiac disease. Yeah, yeah,
Yes. And because not only can I see it with
right.
the AI reports and the beautiful pictures we get and
Hmm.
the, detailed description as well,
Hmm.
anyone who doesn't even know what the heart looks like, don't know what blood vessels look like,
Right,
you can see it with your own eyes, what your arteries look like on the inside. And
right.
we have examples, as you know, you've seen them where there's a problem.
Hmm.
There's severe coronary artery
Right,
disease, vascular disease. And then we put them on some of these protocols you and I are talking about and test again, and it gets much better. And other examples where it looks pretty good. And then the follow-up test with artificial intelligence, you can see the cardiovascular disease has gotten much worse because they didn't get to some of these root causes or
right.
contributors. They didn't change things. And so it's powerful. It's so powerful. I am so excited because number one, this is the thing that irritates me the most is that every person in the world does not have access to this information and to this
Hmm.
type of care.
Right,
Number two, that heart attack is still the number one killer and stroke is right after it. Stroke's the top cause of disability, which
right.
wants, to be disabled from a stroke and live the rest of their life that way.
Hmm.
And we do have answers. Can we
Right,
eliminate every single one of them? No, I'm not promising that, but we do have answers to knock it off the top spot.
right,
That's
right.
everybody got some of these simple tests like you and I are talking about.
So let me guess, you're the stuff you do isn't covered by insurance, right? Yeah,
Insurance. And, again, I hope we live in a time where ultimately we'll see that everyone has access to this kind of care.
right.
I am happy to help fight that fight,
Hmm.
but there are people such as myself that is what they're aggravated about. That is their fight, and they're
Right.
going to try to make this
Hmm.
accessible. That's not my strength. My strength
Right,
is I love to figure out what's going on inside your body. Let me help you,
right.
the person sitting in front of me, and
Yeah,
let all of the bean counters figure it out.
right.
And now it's just not covered by insurance. And
Yeah.
what's interesting too, though, is you're hearing more and more about this, particularly the saliva test, but some of these
Hmm.
other more not as well known tests that are extremely valuable at the level of the American Dental Association and even the American Medical Association, kind of. Certainly, we've said the American Heart Association is moving that direction a little bit. They haven't come out
Yeah.
with a statement, but we will see if you haven't seen it yet that the Center for Disease Control, whatever you think about them, is now admitting that there is a relationship between oral health and what's going on in the mouth and some of
Wow.
these diseases. And so
Gotcha.
maybe someone's making some progress somewhere to try to get the attention of the insurance, decision makers.
But again, it's like watching a glacier melt sometime. In the meantime, we don't have to wait though. So
That's
we
right.
can go to the spittest.com
Yes.
and you can get the spit test there, the saliva test, and at least figure out what you're dealing with. And I think it's going to take, like most things, public outcry on this. I mean, I don't want to wait 10 or 15 years for everybody, the associations to get their act together. And so they can come to you and you have treatment protocols. I mean, that one starts at 249. And I don't want to put you on the spot here, but I know you've got programs where you also deal with longevity as well, and you use state of the art things in there. And your programs, can I tell how much your top program is? You
Sure.
mind? I
Yeah,
mean, if you
certainly.
don't want me to, I won't. Yeah, but
No,
it's
you
so
definitely can because
okay. It's not
yeah, I
secret,
think
right?
it's
Yeah. So for you have a program that's $1 million a year, right? That will take in, I think it's two people,
that's
usually a
correct.
couple, or if it's a CEO, the thing, and you give them all the knowledge that you have that you pick up and change every day,
Mhm.
reduce the chance of all of those things as much as the latest scientific information as well as longevity and your whole. And I know you've got programs much less expensive than that, but so your whole thing is, and I know as I've come to know you, is that it's not only about the quality of life, but how long you live. And my thing is I always want C, all of the above. And there's no reason to exclude those, right? There's no absolutely no reason to exclude either one of those. You can live long, be healthy, do the things you want to do, things that you love to do, and until you're well past your 80s and 90s and beyond, right?
That is definitely true. Just like I said earlier, it's true you can reverse cardiovascular disease. I was iffy on can we really live to 100 and feel great at 100? Now it's well beyond that.
Yeah,
I know we can. And I've seen people reverse their age, which is another metric we have now where we can
right.
actually see on the inside, are you like me? I'm 63 years alive on this earth
Right.
chronologically, but biologically, am I 63 years? We want to age more slowly than the
Right.
years go by, and we can test for that as an example. But yeah, I want to just say that everyone can follow me on YouTube for free, and I
Right.
give information just like this every day on
Yeah.
YouTube for free. And there's a lot of low dollar programs, a low dollar ways and free ways to get education. We just
Yeah.
talked about a $250 way,
Right.
249 to learn a
Yeah.
key contributor to heart attack and stroke and all of those diseases,
Hmm.
and know what to do about it. And
Right.
so, but the reason that you bring up that other point is what we find is there are people that are incredibly busy,
Hmm.
and there are a few steps in the beginning once you get all of these tests back
Right.
about when do I work out and exactly what does cooking this way look like? And
Hmm.
do I need a yoga instructor? Do I need a special type of equipment? Help me with sleep. These are easy fixes, but there are people that just say, I want to just come see you. And for 2 days, bring the yoga instructor, bring the chef, bring the whatever, and
Right.
let's
So
live that
it's
style.
not just a doctor's visit. You actually, well, you I think your team will go there too, to their
Yes, we will
place
go
as
with
well.
them, or we'll go
Right.
to a agreed upon location if they want to
Right.
get away from home and go somewhere else.
Right.
Spend 2 days, and
Right.
we just live and breathe this information and this lifestyle so that they can see
Right.
visually, live and experience. Oh, I could do this. A lot of
Right.
people leave and they're like kind of overwhelmed. So we offered this for people that said, I wish you could have helped me understood all that in the beginning. Well, it
Right.
takes a couple of days and it can be a lot of fun. And
Right.
then see it, you can one make the choices of how to prioritize. I'm going to
Hmm.
do 2 and 3, but I'm not going to do all of that. Or
Right.
I can make all of those changes.
Yeah.
Anyway, it's a great way. Keep increasing accessibility to us, right? Like
Right.
here's the information, do it yourself, and then
Hmm.
there's middle range program where it's like we'll do it with you, but
Right.
go away with you and your spouse for 2 days.
Right. Yeah. You can't afford to do that. I mean, yeah. Well, you're one of the few doctors that I know will still do house calls.
That's
So
right.
that in itself is useful. And I know not all your programs. I don't mean to tell everybody out that if you don't have $1 million, you can't talk to Dr. Pritchard. That's not true. You've got programs that are way lower than that. But okay, tell me this: how much is a heart transplant these days? Do you have any idea? It's got to be.
Heart transplant? I don't
Yeah.
know. Bypass surgery, it's hard to
Is
get out of there with a coronary artery bypass graft surgery in
mhm,
a maybe. I mean, I hate to say that, maybe it's not the state of the art even, but it's
right.
hard to get in and out and have
Yeah.
that procedure for less than
Right.
$350,000. A lot
Wow.
of times it's $1 million, depending
Right.
on what all they had to do. Were there any
Right.
complications? How long did you stay in the hospital?
Mhm,
A
yeah.
lot of, potential increase in costs.
Yeah.
And I haven't checked transplant lately, but I'm sure it's more than $1 million. I'm sure.
Yeah. So it just really matters how much you want to put into it. And you don't have to spend 1 million. I don't want to get rid of that
Yeah,
dollars. You could spend 20, 30, 40, $50,000, which is less than and most of these things cost too. And you were involved in acute cardiac care. That's where you kind of figured this stuff out. And one of the things that you told me, and I don't want to make this forever, but this if you can't tell, this fascinates the heck out of me. Because the cool thing about this is if you pay attention to this, and this information, not only this, but other ones, it can save your flipping life or your loved one.
Mm-hmm.
So you talked about people that get stints, and I've kind of seen this. So a stint takes care of about a half inch of your circulatory system, right?
That's right.
And you told me I got this. There's 60,000 miles of circulatory system. So that's like patching one hole in a road that circumnavigates America like 10 times, and they're patching one little pothole, and the rest of it is not taken care of. Is that kind of accurate, and why people end up having 1 or 2 or 3 or 4 stents.
Yes, Andrew, I'm so glad you brought up that point because you've heard my story in that that's why I finally had to leave the hospital because it felt like such an incomplete care of the patient, and it was a Band-Aid approach. Yes, it's saving your life in the moment. Yes, you're going to feel better and go home in a few days or the next day or whatever it is. But then and even today, I don't know how many hundreds of thousands of doctors, nurses, nurse practitioners will send people home at discharge. And anybody who's listening to this, I bet you've heard something similar, either told to a loved one or you've heard the story where we send someone home and say, we put a stent in that 90% blockage or that 100% blockage or that 80% blockage where the problem was. It's got this scaffolding in there now that's holding it
Right.
wide open. No problem.
Right.
You'll be fine. And the rest of your arteries that we looked at, your rest of your blood vessels, just have a few lumpy bumpies, a little irregularities, you'll be fine.
Yeah.
And when I realized that was not true, it's an entire system. We would put a stent in and we might see one of these lumpy bumpies right next to it or just a little ways down the vessel and tell them home to go home, they would be
Yeah.
fine. But now with artificial intelligence, we know nothing could be further than the truth. They may
Right.
have a problem next week, next year, 5 years, but they will have another problem if you leave the rest of the blood vessels at risk and don't test and treat these other things that contributed to it in the first place.
Right. It sounds to me like that's a house that's because I've had one we bought that had termites everywhere, you know, and so that'd be like us going in and replacing the one board that we saw and letting the termites go through the rest of the house.
Yes.
That's again nuts. It's just crazy.
That's exactly right. Yeah, the
Oh,
standard of care has got to change. This is
yeah.
optimal care, and I'm not the only one practicing this way,
Right.
but most of the world is practicing standard of care, which is find the disease, name it, give it a code, and then give the person a pill or a procedure and maybe a little bit about lifestyle changes and send
Right.
them home. And
And
that's
they
not saving lives.
right. And they're not testing your saliva. Or
You know,
they're
testing
not
your
doing the saliva screening. So anyway. All right. Well, I'm going to wrap this up. I don't want to, this took way longer. Thank you so much for doing this. We've been talking about doing this for a couple of months now. Hopefully you, the listeners, got something out of this. I know I was blown away. Something that simple could make a big difference in your life. So I'm going to say something here. I'm not going to put words in your mouth because I don't want trouble. But if I was getting a tooth implant, if I was getting if I was going to have a crown or what's the thing where they take out the
root
nerve?
canal.
What's
Root
that?
canal.
A root canal. If you
Even
don't
gum
get,
procedure.
yeah,
Yeah.
even any type of gum procedure, or if I was going in to have like a hip replacement or any type of operation, I would be getting this test first because yeah, anyway. Or if you're just feeling okay or not even feeling okay, go get the darn test and see where you are. I think you'll be shocked. And so anyway, spittest.com. I'm going to tell everybody in their mother-in-law about it. Hopefully some people will save some people's lives. I had no idea. This is just amazing. And hopefully too, there are doctors out there that are like you. They're kind of far and few between. But if enough people, again, you, the audience is watching this, make sure you ask about it. Ask your doctor, ask your dentist or nurse practitioner, whomever you go to about this. And if they don't know about it, just go on Dr. Gina's site at the Prevent Clinic, spittest.com, and skip your next heart attack. And you have the information so they can be educated on this stuff. And I don't even know how many people's lives you're going to save, or it just, how many people have diabetes these days? I mean, I know so many people have diabetes, but I don't think I know a single one that has ever been tested for their saliva. Anyway,
Gotta
thank you so
change.
much. Yeah, it's got to change. Thank you so much. Anything else you want to say? I don't want to be blabbing on.
Not other than thank you very much for putting this video together, for
Yep.
interviewing me and getting the word out there.
Yep.
That is the biggest problem. Like, doesn't do me any good to have this information in my head and
Right.
teach maybe a group of 10 or 20 or 50 faculty at the university at LMU or
Right.
other cardiologists or dentists or dental hygienists nurse practitioners like we're doing,
Mhm.
but it's just too small of a number to explode the message. And so with your techniques, you can explode the message, and hopefully the masses will go begin demanding these kind of tests, starting with the saliva test, demanding thorough information so that they can take care of their own bodies. It's out
Right.
there. So everyone that's listening, help us get the word out. And I just want to say thank you to you, Andrew. I
You're
appreciate it.
welcome. I'll leave with one of my favorite quotes by William Gibson. The future is here, but it's just not evenly distributed. So anyway, that's about it. We'll put all this information in there, folks. Thanks for watching. Thanks for listening, Dr. Pritchard. Thank you again. This has been fun. Hopefully, I know you've got expertise in a couple areas too that I want to interview just for me. Hopefully people will like it, but I've got like about a million more questions on this. And I know you had a very busy week, and I know I did too. I want to get you when we're both well rested, although that's not any any doesn't show against you, but I've just been running a million miles an hour. But this is so exciting. Thank you again, and we'll talk to you later. We'll have all the links, people. I'll put this on many of our channels as we possibly can. And then if you have a loved one or yourself, please share it with someone else. You could say you literally save their life or save them from a whole bunch of hurt and pain and being in a hospital and not being able to enjoy their life as long as or as well as they could. We'll talk to you later. Thank you.